Makes up the tip of the nose. So I'm going to suture it to this strong piece of cartilage here. I'm Dr. Mark Jabor with Cosmetic Surgery Laser Center of El Paso. Today we're going to be performing a rhinoplasty. So the patient is already here on the table, asleep, injected with local anesthesia. So it's changed the shape of the nose a little bit, but I think you can still appreciate the main goals are going to be to remove this dorsal hump, to bring that down, and to address the tip, the drooping tip, and to refine the tip as well. So those are going to be our main goals. There's also a little bit of a deviation in the septum, and we're going to take care of that at the same time. So let me go ahead and I'm going to show you the key steps as we go along with this rhinoplasty procedure. Okay, so here we're going to get started, and I'm going to do what's called an open rhinoplasty. And so what basically defines an open from a closed is making this incision right here. With the closed, you don't make that incision. You kind of pull everything out, and you do it. It's kind of, I think, it hinders visualization. But with the open, I can make that incision. I can peel the entire skin back, as we'll see. And so you can very precisely make changes to the tip of the nose. So here we go with the incision. Alright, so along with this incision, I'm going to have to make incisions that are going to come all the way around the alar rim so that we can peel that skin back. So as we get a little further along, I will show you. So we have the skin, elevated and pulled back. Now you can directly see these lower lateral cartilages, which are right here, these C-shaped cartilage, which that essentially makes up the tip of the nose. So anything that you're going to do that's going to involve the tip of the nose, you're going to have to alter this, whether you're removing cartilage, suturing cartilage, a combination of those things. Starting here is the dorsum of the nose, which is the upper lateral cartilage, which and then it goes up to the bone, to the nasal bone. So, and then we're going to manipulate both of these things here. So let me show you as we go along. But I wanted to show you the anatomy there before it was altered in any way. I'm going to be putting the cuts in the bones now. I went ahead and I basically have isolated the septum, or the middle partition of the nose, and I made a cut on it because we're going to do a push down technique. So what's going to happen is going to be a cut here, and then in the middle leg, or if you can think of the nose as a tripod, that's been cut, so then we can push the whole thing down without having to rasp this. So you've seen me do this technique before. Tap, tap. Tap, tap. Tap, tap. Tap, tap. So I'll continue until I get that complete cut here. I'm going to make a small incision to complete the cut, and then I'll do the same. It's going to be the same on the other side. So the cuts have been placed on both sides of the nose, as well as this is bleeding a little bit here from the completion osteotomy. And so now I'm ready for the push down. So what I'll do is just simply take my thumbs, and we will push down. And you can see, sometimes you can hear a little snap, sometimes you can't. But from there, you can see that it's already lowered. Now, what I can do is, and what I'm going to do is I'm going to go inside the nose, and I'm going to trim more of that septal cartilage. So the more of that septal cartilage that I trim, that's the third leg, the more that this is going to lower. We don't want to lower it too much, but we want to lower it some. And so I can kind of control that by the amount of the septal cartilage that I'm going to trim. So I'll do that until I'm satisfied with how the dorsum looks, but you can already see that it's lowered pretty significantly. I'm probably going to go just a little bit more on that, and then I'll come back and show you. So I've sewn in what's called the septal extension graft. You can see this is part of the septum that I removed, and so it's sewn in here, and you can see it's sticking out farther than, this is the septum, than the natural septum. And the reason that we do that is because this is going to act like a pillar or like a buttress, so that when I put the tip, I can control the tip. I can put it this way, that way, up, down, whichever, and I'm going to suture it to this strong piece of cartilage here, and that's going to support the tip post-operatively and allow it to stay in the position that we put it. So I think it's a very sort of an important maneuver that you can use on rhinoplasties when trying to manipulate the tip of the nose. Step is we're going to take a small piece off of this lower lateral cartilage, or what makes the nasal tip so wide. So I'm making the incision there in the cartilage. And then I'll go ahead and remove that piece there. So there we go. So this piece here, you can see that's going to come off, and that's going to help with the overall width of the tip. That's about the only maneuver I do that's sort of destructive, if you will. The rest of it is considered preservation rhinoplasty, and I'm very conservative on this because I want to leave a large portion of this cartilage so that the tip doesn't collapse. The mistake that a lot of people make is they'll keep whittling down this cartilage here. Yes, certainly it makes the nose smaller, but it also causes a lot of defects and deformities afterwards, so we want to prevent that from happening. I've secured the tip of the nose to this cartilage like what we talked about, so then that's going to keep it really fixed in place well. So I'll finish tying that, and then maybe put another couple sutures, and we're going to be close to being finished. We've secured that to the cartilage. So now we've got a really nice secure tip. So if we take this off, it's what I always do, kind of back and forth multiple times during the case. Just take that off, put the skin back, and see what we have. And so, you know, I'm pretty happy with how that looks. So I think we're ready to start closing and calling this one a day. Alrighty, we're all done here, and everything's been closed, so you can see kind of the final contour. So, you know, we mentioned about taking out the dorsum. We did that. That was with a preservation technique. We opened the nose to refine the tip. The only cartilage that was removed from the nose, other than the septum, was just a little sliver from right here. Everything else was done by sutures and supporting the nose. And so, what we refer to as a preservation rhinoplasty. And hopefully this is going to withstand the test of time and scar contracture and all the other things that happen post-operatively. But I think you can see the quite a bit of the difference in the shape of the nose and the proportions. So I'm very happy how it looks. We will put a splint on. She'll go to recovery room, and she will go home after that. I'm Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Thank you for watching. If you like what you see, please give me a thumbs up. If you want to become a subscriber, you can see all the latest content.